Should your baby poop every day? How often should your newborn or infant poop? And when should you start getting concerned about their poop? If there is one thing that stresses almost every parent out, it is baby poop. It's either too much or not enough or not the right consistency. By the end of this video, you are going to get comfortable about baby poop and what to be concerned about. I am Dr. Nkirika. I'm a pediatrician and pediatric care doctor, and I'm also a mom of 3. Like every adult, every baby is going to be different, but every newborn is going to start with meconium. Meconium is the first poop that every newborn passes. Essentially contains proteins, cells, and fats, which fills their whole intestine before birth. Your baby might poop meconium as one poop or as multiple small squirts throughout the day or within 24 to 48 hours. After that poop is passed, your baby's poop is going to vary in both frequency and consistency. Babies who are breastfed may have poop that looks a little more mustard, light yellow, and seedy. Babies who are formula fed may have poop that's a little thicker than those who are breastfed, but should also not be thicker than peanut butter. Hard stools, pellets, pebbles in any baby that's younger than 12 months old means they're constipated, and essentially means they're not getting enough fluid that they require, or maybe is losing a little bit too much, which means they're probably sick. When it comes to colors, baby poop can have different colors. We already talked about the meconium, which is a dark green or black stool that happens at the first day. After that, you would typically see yellow or mustard color. You may also see a little bit of green sometimes. And when a baby is teething and drooling a lot, you may notice a little bit of mucus and greenish poop sometimes as well. If your baby is on any form of iron supplements for anemia, you may notice darker brown or dark poop. A few streaks of blood may be seen within the first couple of days of birth if baby swallows a little bit of blood from the mother's nipple. Other than that, any blood in the baby's poop should be evaluated. White poop is always a red flag. Yes, it might be due to a viral infection giving them diarrhea, but we're also concerned about liver problems when it comes to babies and white poop. So any white poop in a baby should always be evaluated by a regular doctor or even in the emergency department. Now let's talk about the frequency. Most babies are going to poop within 1 to 3 times a day during the first 2 days of birth. Some may have just a smear on their diaper, some may have actual poop every time they go. After those 2 days, within the first 2 to 3 weeks of birth, most babies are going to poop every time you feed them. This is because they have a very active gastrocolic reflex, which means essentially anytime food hits the stomach, they are going to poop. So this reflex is actually more active in some babies versus others. If your baby poops immediately after you feed, you can actually consider feeding first before you change your diaper, because they're more likely going to sew the diaper again immediately after you feed them. By 3 to 6 weeks of age, babies actually start spacing out how often they poop. And some babies, especially those who are breastfed, may actually go 1 week without pooping. Yes, I know this becomes very stressful for families, but I promise you it is normal and it is okay. It is not constipation. As long as your baby's belly is soft, as long as your baby is doing okay and not vomiting feeds, as long as your poop is actually still soft and pasty or like peanut butter, it is normal. And that's what they normally do as they get older. They start to space out their poop. Babies who are formula fed may still poop once a day or may poop between 1 to 3 times a day. But you may notice a little bit of a difference when you give your child your baby formula versus breast milk. As babies get older, towards about 6 months of age, you may even start noticing when you start adding solids and other food, they may either start spacing out their poop more, or you may start to get a little more of a schedule to your own baby. And some babies may actually poop every day, every alternate days, on a regular schedule. When it comes to consistency of baby poop, seedy, pasty, melted chocolate, peanut butter are usually what we consider normal when it comes to baby poop. Sometimes you may get a little bit of watery poop, but it should not last more than a couple of them. Pellets, pebbles, pencil-like poop, and hard round poops are usually not considered normal in babies and are called constipation. Now, what about those sounds you hear when your baby is trying to poop? Should you be concerned about them? That grunting, uncomfortable movement, squirming around before babies poop is called infant dyschezia. And this essentially happens because babies lay down when they're trying to poop. Their whole system has not figured out the whole concept of pooping. And that makes it seem like they're super uncomfortable. So they grunt, they cry, they may even turn for about 10 to 15 minutes before they have a poop. But as long as the poop is soft, again, there's no blood in it and it's not white, it is okay. Infant dyschezia in babies may last between 3 weeks to about 6 to 9 months. Every baby is going to be different, but I always want you to watch for red flags to know what you should be concerned about. Now, I'm talking about the red flags. What are the red flags you should always watch out for when it comes to newborn, infant, or any baby poop? Rock hard poop. When they start having hard poop, they're more likely going to get uncomfortable, but also might tear their buttock area and may actually lead to bleeding. When your baby is not pooping, but also not tolerating their feeds, I'm talking about vomiting or just not interested in feeds, I would want that to be checked out. Colors. Black colored poop outside of the first 2 days of poop, which is meconium. Red poop, but also any white poop in a baby is a red flag that needs to be evaluated. Another red flag that might be a little confusing for parents is diarrhea. A lot of babies may have liquid poop. Some babies may have maybe a 24-hour virus that makes them have some liquid poop. But the reason we're concerned about diarrhea in babies is the more they poop, the more they lose fluids and can easily have electrolyte imbalances. So if your baby who's younger than 6 months old has about 1 to 4 poops that are liquid and actually they are still active and it's okay, that's okay. But if your baby is having more poop, not interested in feeds, pooping a lot, and you're not able to tell if they're actually peeing, I would want you to get that baby evaluated. Make sure there's no dehydration, to make sure there are no electrolyte imbalances that actually need them to be seen, or have an IV hydration. With this whole variety and confusion and discomfort around baby poop, here are some things I want you to know. Baby poop should always be soft and pasty and like peanut butter, but not hard. Baby poop can be yellow and gray and mustard color, but not white, not red, and should not have black after the first 2 days. Babies can poop every day, but as they get older, they're definitely going to start spacing out their poop and may poop once a week. As long as the belly is soft, as long as they're keeping their foods down, it is okay and you are doing great. Thank you for watching. If this has been helpful or you have other questions about baby poop, let me know in the comments. Otherwise, if you want to know more about constipation, 10 foods that can help your baby not be constipated, and 10 foods that can actually worsen their constipation, go watch this video right here. I will see you in the next video.